folks who are trans and non-binary, one of the things we know is that it can be hard for them to find community in the world that we live in. What we do in our clinic is share with our patients information that Pride is coming. We encourage them to attend for sure. Some of us as providers have gone to Pride in San Mateo, and we sort of talk about our services. The fact that gender is these days, how we conceptualize it, how young people are talking about it is changing a lot. And so we celebrate with Pride and in Pride spaces that are safe and welcoming. And for me and for a lot of us, Pride becomes an invitation for the community we serve to go find more community and to feel right and to belong. But it also becomes a place just to be more creative in talking about gender as something that right now is developing as something in our world where people get to find spaces where they can be more themselves. So what we've noticed at events like Pride is that people come and share their experiences, but they also sort of continue to create space and language for how gender as a topic is expanding just in our world and our communities. But it also helps folks like us, like providers, form our abilities to take care of them.
Well, one thing, luckily, is because the gender clinic doesn't really function as a physical space. They're not, I think, as intimidated by the building or the awards or anything, because it's mostly just them popping into a Doximity meeting or talking to me on the phone, which I actually think really does do a job of, a good job of increasing the sort of perceived equity there. A phone call is not as intimidating as a lot of other things. And this is a joke from someone else, but I don't usually come out when I talk to people, and my own experience is my own experience, but just me talking is like a pride parade. It usually doesn't take people very long to kind of figure out what's going on. So that, I think, oftentimes can create a sense of safety. Not always, of course. I think really trying to come at everything from a trauma-informed lens and really being aware in particular that our trans non-binary folks have often suffered a lot of big T and little t traumas through their life and along the way. And I wish that weren't the case, but really just being incredibly mindful of that. Providing as much information about what the reason for the visit is up front. And that I try really hard to tell people I'm not a gatekeeper, that that's not the role that I want to be in, that my role is to be exploring and informative. I can provide some information and some feedback, and even sometimes recognizing and making it explicit that the way the healthcare system works is that we need to give you a particular diagnosis so that we can get particular benefits and supports for particular treatments. And so we will be assessing for that, but in the least pathologizing way that we can, with a real understanding that our goal is to try to help make you yourself in the safest possible way.
Totally. I mean, I think one of the wonderful things about being a provider who does patients who are seeking gender-affirming care is that really it's really about what they want and what they they're guiding the way, and also recognizing that I may have some insights that they may not have in terms of what some of the treatments may bring them, but also some of the negative side effects or some of the things that may happen along the way. But I think that really trying to understand what their goals are and really letting them lead the way. So that's been a real benefit. And I think one of the wonderful things about working in with this population is that you get to witness a lot of courage and a lot of often very deep introspection about what their goals are and what they want, and what type of life you want to live, and how do you kind of navigate towards that. It's a really wonderful thing to be able to stand beside and watch patients as they navigate towards a life that is more in line with what they want.